There are certain basic facts of life that relate to the health of individuals, households, and communities at large. These basic facts of life include the fact that water, sanitation, and hygiene are essential to good health and the overall well-being of individuals, households, and communities. Safe water, good sanitation and hygiene promotion, and safe behavior is central to combating diarrhea and other illnesses that reduce productivity and lead to unnecessary death. Water supply and sanitation are key determining factors to achieve all Millennium Development Goals, especially those related to child mortality and morbidity, nutrition, and poverty reduction. It is in this vein that CHF International, with funding from USAID and in partnership with metropolitan, sub-metros, local NGOs, water and sanitation boards, and CBOs, is implementing the WASHUP project. WASHUP actually is an acronym meaning Water, Access, Sanitation, and Hygiene for the Urban Poor.
We have 5 key components of the WASHUP project. We have improving access to water, sustainable access to water. We have improving access to sustainable sanitation. And then we have another aspect that is called the business development aspect, where we try to see how community members, remember we are working in the urban poor communities, so we are seeing how by improving the economic activities of the community members, how that can improve their living conditions and how that can help them have some income to be able to access the water and sanitation facilities that are being provided. And the 4th aspect, or the 4th component of the WASHUP project, is behavior change communication, using strategies, interpersonal communication, drama, and all the strategies that you can think of, mass media and all the communication channels, to try and appeal to the consciences of community members to improve their behaviors, or some of the behaviors that need to be changed so that the living conditions and the sanitary conditions in the community will be better.
The project started around the middle of May or mid-May 2010 with introductory activities. These introductory activities included brief sessions with metropolitan and chief executives, district assemblies, Ghana Education Service, the Ministry of Education, and several stakeholders, and also community leaders, opinion leaders, chiefs, and the like. The main focus of this activity was to introduce the local NGOs who would be working in these various communities to those who matter in the communities, so that they can offer their maximum support and cooperation. This was done in mid-May. The actual takeoff of the project was around the middle of June, where we started with several activities. The first activity we carried out was the school outreach activity. Now, the school outreach activity basically was to sensitize school children within mapped out schools in the project communities. We went to these schools and initially held discussions with the school authorities, who also gave us their maximum support and cooperation. We undertook class-to-class sensitization, talking to the school children about the need to ensure good sanitation and hygiene practices, and also the need to wash their hands at 5 critical times. Now, these 5 critical times are before and after eating, after visiting the toilet, and after returning from school and play. And also, we saw that these children can be agents of change. So we educated them to educate their mothers so that when they change diapers of babies, they would also wash their hands. We worked in about 18 public schools within all the project communities. And school children were very enthusiastic and they volunteered to be part of the wash clubs, which have been established in all the 18 public schools that we carried out school outreach activities. Mosque and church outreach activities were organized to sensitize community members towards the establishment of community support groups. It was also a platform for health education on sanitation and personal hygiene, especially hand washing at 5 critical times. Sensitization activities were very effective. As such, mothers' clubs, daddies' clubs, youth clubs, and drama groups were established in each project community.
Adole.